looking at holistically what's going on in population health, there's two areas that continue to be major, and in some instances, growing challenges. And I think back to how we got a handle on it. Actually, a substantial improvement in the smoking rates in the country, and it wasn't one thing; it was a lot of things, right? That happened over a period of years, and we have two persistent key issues: obesity and opioids. What are your thoughts? What do we need to do there? I bet it's not one thing, but what are some of the things we need to do if we're going to get our hands around those two issues?
I'll let Bruce take notes.
Okay. Yeah, go ahead, Bruce.
No easy answers. I think from an opioid standpoint, there's the piece of this that's related to overprescribing, both in terms of frequency and volume of opioids through the current healthcare system, and I think we're taking steps to reasonably address that. I think the bigger issue is how the current environment is creating, especially for individuals in lower income categories, sustained depression, stress. Opioids represent, for some individuals, a very attractive escape from that. And until we address some of those underlying issues, we have a challenge on our hands.
Yeah, I would agree. I think the social support, the purpose-driven, those people are probably less likely to, rely on an outlet such as opioids. When you look at the obesity aspect, that is much more complicated than people think. People think, oh, we'll just, eat less, exercise more. But there are a lot of genetic components too that are being identified. So it's much more complicated than just, and so it's probably a symptom of other things going on versus an actual disease. I mean, it leads to a lot of things, but I think it's a symptom of other things going on, and it's multifactorial.
Yeah, I mean, our population suffers the same way others do less from the opioids, honestly, probably than an average population, but certainly from obesity, and just, lifetime habits. And that's that behavior modification that if we had that key. I will say that, we've had fair success with bariatric surgery. That's become a much more acceptable. I remember talking to a patient once who said it just felt like such a defeat to her that was what she had to do. And I don't think patients are feeling quite that way as much. I think that's because they're going through steps beforehand, and it's more acceptable. And the outcomes are pretty decent. At least they have been with our handful of patients. So,
I've heard people say that in the case of obesity, we're kind of with obesity in terms of our bias around individuals with obesity, where we were with mental health 10 years earlier, right? That there's a little bit of a blame element to this, and yet there is a physiology that is continuing some of these issues. And I agree with everybody. It's not a simple one. I'd also say the lesson from smoking is it's not going to be one thing. It's going to be everybody putting oars in the water, pulling in the same direction, and that includes collaborating public and private sector together. So.
Well, the various communities that have imposed taxes on sugar drinks, that struck me as a no-brainer, but the outcry around that, but that's one of those little pieces. Yeah. That's a contributor, so we're going to make it a little harder to get it, just like cigarettes. It's a contributor, so we're going to make them a little bit more expensive. We're going to outlaw them in certain places. I think you're right.
Yeah. So, just to wrap up, it appears to me that we don't have it licked here in terms of population health, but there's a lot of good things that are happening. And this broadening, looking at it more holistically around total health and well-being is a positive move. I think this orientation towards personalization and patient centricity is a key theme of what holds promise. And again, it's not going to be one thing. It's going to be multiple things working together. And I think the other thing I think we shouldn't forget is the issue of culture, right? That this is not an outsourced, easy, plug in a program and it all goes away. It's really starting to build a culture around health and well-being, and it manifests itself right through the supervisors and the leadership of the organization.